Buenos dias, bienvenidos. Good morning, welcome. Thank you for joining us. I'm Sarah DeGia. I'm the Executive Director of the California Pan-Ethnic Health Network, and it is my absolute pleasure to have you all here today. Thank you for making the time to come. I have the wonderful and awkward job of both welcoming you to the conference and telling you where the restrooms are. I feel like that's sort of the job of the Executive Director. Um, Because we have such an amazing and very full day, I'm not going to be able to go through all the logistics. But what we did today was we provided for you a handout and an FAQ so that all of your all of your questions will hopefully be answered. And there's a map to kind of direct you throughout the day. There are restrooms very close by. There's a new mother's room and restrooms at the front as well. We want to make sure all of your needs are taken care of. We also have our hashtag, Voices for Change 2018. So please use it wisely. And there's lots of other logistical things that are there as well. One thing I want to point out is that we have an amazing, again, full day. And at the end of the day, we have a closing plenary and a raffle. So we have some very cool prizes for you as a reward for staying. Also a rewarding closing plenary. But in order to be able to join into the raffle, you have to stay. So you must be present to win. And in order to get that ticket, you need to fill out your evaluation forms, and you can bring them in at the end of the workshops to get a ticket. So just want to make sure that's on everybody's radar today. Before we launch into the program, it's really important for me to give thanks to some very important people because this conference would not have happened without all of their hard work. And if I've learned anything in the past 4 years of being the executive director of CPEHN, which I just passed my 4-year mark, thank you. Usually I do a little newsletter article, so preview, you're all here for the in-person newsletter article. But the one thing that I've learned, top of the list, is gratitude. So let me take a moment to thank all the people and organizations who made this day very special. So first to the California Endowment, thank you for the wonderful space here and for providing us with the opportunity to gather today to talk and be here for all of us. So thank you for letting us be here today. I want to thank our guiding forces, CPEHN's board of directors. Without you, we would not be fiscally responsible. No, without you, you provide us with the vision, the support, and the guidance. So thank you for all of your hard work. And if I can just actually ask my board members who are here today to quickly stand. Kathy Ko-Chen, Jeffrey Reynoso, Doretha Williams-Flornay, Tanya Lapule, Michelle Cabrera are all here today. So thank you very much to all of them. The board members who aren't here but who send their wishes are Sharad Jain, Mark LeBeau, Nomsa Kalfani, Nayamin Martinez, Tony Dang, Jim Gilmer, and Janet King. And Jan Carver is here today from the California Royal Indian Health Board as well on behalf of Mark. I'd also like to thank our sponsors, and you'll see their names scrolling throughout today. Without your generous resources, again, we would not be able to put together such an amazing program. So thank you to all of you for your support and your guidance as well. And last but definitely not least, CPEHN staff. These folks have put their heart and souls into the conference today. It's kind of like a concert, all the moving pieces. So please join me in thanking Aviva Prager, Kirti Kanchanadam, Carrie Sanders, Kimberly Chin, Saili Willis, Jillian Rice, Carolina Valle, Ricardo Sanz, Rachel Katz, Kieran Savage Sangwan, and Michelle and Mihei Jung. Thank you so much. Round of applause for all of them. So, and if you haven't noticed, the list of names has gotten longer. I'm very proud of the growth of our staff. And again, thank you to our funders and our sponsors and our board of directors for all of the support that you've given us to be able to grow the staff to continue to do the great work. So almost 2 years ago, on October 18th, 2016, we brought people together in Los Angeles for our conference. It was before the national election. And 3 weeks later, we began a journey that I don't think any of us had imagined. It was a journey to protect the precious wins that we had just gained and the precious people that we love. But in many ways, it was actually the continuation, right, of the fight that we've been fighting for decades. The fight to be resilient, to be visible, and to be powerful. These past 2 years have tested us beyond our imagination. They've tested our resolve. We have likely felt that pull to divide our communities or to simply give up. But we have resisted, we have stood together, and we are continuing to fight for change. We have demonstrated what it looks like when you stand together. And we have shown the power that we have together that is immense and that we can see the change coming. And that's part of what today is about, that we want a vision for what health equity looks like going forward, and that we're not ashamed or afraid to put that vision out there and to continue to fight for it. So today the program is really designed to do that. It's designed to give you information and analysis, and it's designed to provide concrete solutions for how we're going to move health equity forward, and maybe even some controversial ideas for creating the change that we need. We're going to have an amazing and groundbreaking and award-winning keynote speaker for you today, Maria Hinojosa. Yeah. And she's going to share her personal story, but also her perspective at a time in which journalism is very much under attack. We're going to have a panel of experts who are going to talk to us about what we can expect at the federal level. There's some things that are going to be coming down. There's a very important election in a couple of weeks, and we want to know how we can support what's at stake. And after lunch, a brief lunch for the evaluations. I already know that's going to be a factor, but we want to cram it all in for you today. So after lunch, we're going to move into workshops that are designed to talk about what are the key state issues that we need to be focused on going forward. And it really does span the breadth of CPEHN's work. And it's a chance to also highlight the amazing local and state partners that we work with. We're going to talk about immigrant health and safety, healthcare coverage, integration of mental and oral health, local infrastructure that's happening that's really infusing equity at the center, oral health, and community resilience and healing. So put that in your mind. You'll have an opportunity to choose your workshop a little bit later. And we have put a lot of thought into today to inspire you, to create a space for collective learning, and to catalyze for greater change for health equity. So this is also CPEHN's 25th anniversary. Yeah, thank you. And I want to take a moment to highlight CPEHN's work over the past 25 years. And I especially want to thank the founders of the organization. So for CPEHN board and staff members, can you please stand? So all CPEHN board and staff. If you're a former CPEHN board member or staff member, would you also please stand? This is your physical activity for today, just as a heads up. If you're a part of the Having Our Say Network, the Behavioral Health Equity Collaborative, the Oral Health Network, if you're part of our CPEHN network, if you could please stand. If you've ever been to a CPEHN event before, could you please stand? And if this is your first CPEHN event, would you please stand? So to the founders of the organization, I say to you, please look at this room, and this is the work of your vision. On this 25th anniversary, go ahead and sit down. No, yeah, thank you. But on this 25th anniversary, I really want to pay homage to our founding partners because they are the ones who created the vision for CPEHN. It was out of destruction and despair of the negativity and the violence of the early 1990s, where these organizations, the leaders of these organizations, came together to create a vision for CPEHN. They understood fundamentally the need to work across racial and ethnic groups. They understood fundamentally the need to work across different silos. They came together to provide a safe space, much like we're doing here today, to think together, to learn together, and to work together for the change that was needed for communities of color so that we can all live to our full potential. I want to take a moment to show a short video just to give you an idea of how CPEHN has grown over the past 25 years.
We began as a simple idea that communities of color in California deserve health equity. And though these communities were largely absent from national healthcare debates, the time was ripe to bridge divisions and unite our voices. The idea took root, grounded by 4 leaders of diverse communities, and CPEHN emerged. Together, we've grown stronger through a shared vision: accessible, affordable healthcare for all Californians, culturally and linguistically appropriate care, social and environmental conditions that promote health, and institutions that address health disparities. Our network has expanded, allowing us to lift community voices for change, thanks to partners like the Having Our Say Coalition. Together, we identify health disparities using data, convene and mobilize community partners, and have branched out to issues like oral and behavioral health. Our collective efforts have bared fruit as we continue to influence policies, like legislation that requires all private health plans to provide language services. Health for All Kids, which expands health care to all children in California, regardless of immigration status, and healthy, equitable land use and transportation policies. Today, CPEHN stands tall, a fully actualized idea that will continue to promote health equity and create positive change in communities of color for years to come.
Thank you. So as the video shows, CPEHN has grown and expanded under the nurturing and the feeding and the support of the founding partners. And we continue to grow because we continue to believe in that vision of the founders, and all of our successes have really given us the opportunity to learn. I could talk for hours about the accomplishments of CPEHN staff over 25 years, but I'm not going to do that. What I do want to do is I want to highlight a few recent wins that I think are really important. So since 2011, CPEHN has passed 14 bills and counting to strengthen language access laws, promote healthy food, create loan forgiveness for undocumented medical students, ensure disaggregated data for Asian Pacific Islander American communities, and promoted equity in transportation. Through our mental health advocacy, we created a mental health plan to address disparities within the mental health communities and are working with the Department of Healthcare Services to improve mental health quality measures. And we're ensuring that community voices are heard at the local level so that local dollars at the mental health commissions are being spent in the right ways. In oral health, we're partnering with the state dental director and numerous organizations across the state to develop long-lasting infrastructure to better integrate oral health into overall health, and to ensure that our communities across the state are able to access recently restored dental health benefits. And CPEHN has helped to put health and equity in state transportation and land use guidance documents, and continues to work with the Health and All Policies Task Force to ensure that equity is at the center of their work. CPEHN is ensuring that our healthcare and public health partners are working together so that healthcare is central to the vision for universal coverage, and that our communities aren't just accessing comprehensive services, but that their communities are designed to be healthy from the start. We've held hundreds of visits with legislators over several years, and we have brought together thousands of members to learn about key issues that are impacting our communities and giving them a chance to connect regionally. And it's not just CPEHN's work, but our partners. Our partners have been amazing, and particularly over the past few years, as we've had to stand up and fight for the Affordable Care Act, they've been the ones that have not only helped keep their communities safe and healthy, but have also spoken up to the media, written op-eds. They've done numerous visits with congressional members, gone to candlelight vigils, rallies. So thank you to our partners for being here for over 10 years now. We really appreciate your work as well. So now I want to invite the founding partners to come to the stage to bestow upon them a recognition for their 25 years of service. CPEHN founding partners, if you could come to the stage, please. So our founding partners, the Asian and Pacific Islander American Health Forum, the California Black Health Network, the California Rural Indian Health Board, and Latino Coalition for a Healthy California. Move down just a little bit. Please give a round of applause to our founding partners. So this is a token of appreciation for your vision and commitment to advancing health, justice, and equity on this 25th anniversary of the California PAN effort. Thank you. So the vision, support, and guidance that has been provided to CPEHN, you can see is now deeply rooted in our foundation. And that these founders have provided us with the richest voices, experiences, and policy solutions to ensure that our communities are well-nourished, healthy, and resilient. So thank you to your 25 years of service and to 25 years more.